some pharmacists have told us, when they're having a return patient coming back, that they'll be the ones who kind of, make that initial outreach and follow up, to schedule that next appointment and to, then follow up with the patient as it gets closer to time. Is that something that would be beneficial to you if they're offering this for your patients?
I would say yes. And I would also wonder, are they going to do some type of reminder call or reminder text so that if the patient doesn't arrive as expected, that they still have made an attempt to reach out to them to get them to come in?
Okay.
I think personally that's kind of a slippery slope, especially in OUD cases, because then what if a patient doesn't follow up for their medical appointments at all? And then, they're not actually there's a lot more that goes into it than just giving them an injection. So I don't know. I feel like that's kind of getting in the weeds. Like, I feel like I would probably rather just continue to follow with them, because I like to do a follow-up appointment, especially if it's early on in their first injection or even their first couple. I like to see them the following week and make sure there's no site reaction and just talk about like their use in general, because a lot of times are co-occurring substance use disorders. So I just worry that if that happens, then they're just kind of going to the pharmacy, getting their injection, leaving, and then not following up at all until 3 or 4 weeks. And now that I said 3 weeks, that brings another point. I'm a huge advocate for all of my patients schedule their injection at 3 weeks for OUD, because I've seen way too many people return to use and overdose at 4 weeks. So I would want to know, if they were to do the outreach, if they usually schedule for 4 weeks or 3 weeks.
Okay, I completely misinterpreted the original question then based on your response to it. I, yes, definitely would still be doing the medical management piece of it in the office. For the purposes of the injection, though, are they scheduled with the pharmacy call to remind if necessary? Or is there some kind of, like the clinic that I work in, we do reminder phone calls and reminder texts the day before, which has helped to increase consistency with keeping appointments. And so for the purposes of just receiving the injection, yes, management still becomes a office clinic-based process.